The deaths by suicide have taken many by shock. Anthony Bourdain, Kate Spade, and Himanshu Rai are just of them. It has also brought attention to the disturbing statistics on mental health in India. The World Health Organization says India has among the largest populations with mental illnesses, yet stigma, denial, and lack of policy focus define our response. Why are residents of popular holiday destinations say ask tourists to stay away, and cricket crazy India may have not qualified for the FIFA World Cup that gets underway in Russia today. But we are making up the numbers in the stands. Among countries whose teams do not qualify, Indians have bought the third highest number of tickets on sale. Among all the newses, the last few weeks have brought multiple reports of death by suicide of high-profile public figures. In America, the conversation among mental health experts after celebrity chef Anthony Bourdain took his own life centers around concerns of suicide contagion, concerns of how extensive news coverage might impact others' lives struggling with thoughts of suicide. Here in India, where spends on public healthcare itself have been pitifully low, never mind the promised. The world's largest healthcare program announced in the last budget, mental health barely makes it to the table of public discourse. Here is why that must change. According to the World Health Organization, India has one of the largest populations with mental illnesses and are the worst hit with depression. 36% of all Indians suffer from depression. Yes, it is true. Young Indians between the age of 15 and 29 make up the world's largest number of suicides. Acknowledging that India is staring at the mental health epidemic, President Ramnath Kovind said, "The biggest obstacle that mental health patients face is encountering stigma and denial. The number of Indians suffering from a mental health problem is more than the entire population of Japan." We need to talk about mental health issues and treat ailments such as depression and stress as diseases that can be cured, not as guilty secrets that must be pushed under the carpet. Citing figures from the National Mental Health Survey of 2016, President Kovind said around 14% of people require mental health interventions. 2% suffer from severe mental disorders. The challenge he admitted was that there is a severe shortage of professional help. We must require 5,000 psychiatrists more and 2,000 clinical psychologists at least. Until recently, attempting suicide was a criminal offense. If people tried to end their lives and survive, they could be prosecuted under the Indian Penal Code, jailed and fined. That has now changed. After the law discriminalizing suicide was notified earlier this month, an India Spend report earlier this year analyzing healthcare spending underscores the near irrelevance of mental health for policymakers. Allocation to the National Programme for Mental Health has been stagnant for the past 3 years. At Rs 35 crores, the program received 0.07% of India's 2017-18 health budget. The budget allocation for 2018 for the National Mental Health Programme saw an insignificant increase of Rs 15 crore. Let's look at a comparison. India's health budget has 0.06% spent on mental health care, whereas Bangladesh's health budget is 0.44% on mental health care, and other developed nations is using 4% on mental health care with infrastructure, frameworks and talent pool. This is despite that the fact is an estimated 10 to 20 million Indians are suffering from severe mental disorders including schizophrenia and bipolar disorder, and 50 million Indians, almost equal to the population of South Africa, are suffering from common mental disorders as depression and anxiety. What about medical insurance for mental illnesses, you would ask? The Mental Health Care Act 2017 states that every insurer shall make provision for medical insurance for treatment of mental illness on the same basis as is available for treatment of physical illnesses. This provision makes it mandatory for all providers of insurance in India to have certain policies and provisions in place that also account for mental illnesses on par with physical illnesses. However, the Health Collective points out that India currently does not have any distinct insurance coverage for mental health disorders, even though several health policies may cover mental illnesses briefly or under other conditions. Now, the gap between mental health needs and treatment is even wider in rural India. Recent efforts thought like a suicide prevention program in Maharashtra's Vidarbha region involving community health workers has reduced the prevalence of depression and suicidal tendencies in the area.